talk to us about the difference again in terms of outcome metrics and process metrics, and the pros and cons of looking at both.
An outcome metric that the finance people care about is what's the cost per DRG, right? Because they get a fixed revenue coming in, and the more things that we do, all that goes against the profit and loss of that particular DRG. So the big things count, like how many days are they in the hospital, how many days are they in ICU, are they on telemetry, but also the tiny things count, like how many CBCs and metabolic panels are we ordering. So if you'd start talking to a CFO about, well, I reduced a few metabolic panels, and they're going to say, well, those cost, $1 a piece. Why do I care about this? So that's not going to get their attention. On the other hand, if you talk to a frontline clinician and you say, well, your cost per DRG is, 5% above the average, that's not an actionable thing. So you have to be able to speak both languages. To the physicians, it needs to be something that they can themselves control the next day. Like, here's something that you're doing that drives up the total cost, and tomorrow you could start doing it differently. So a very discrete action. And whenever somebody would have an idea, well, here's something you need to look at, we say, is that something I could point to someone and they could start doing differently tomorrow? So typically those are what people call process metrics.